awkward time on Wednesday at 4 p.m. and thank you for coming. So today I just wanted to share a bit about my story, about my concussion recovery, as well as all of the scientific information that I learned on my journey. So how many of you here have suffered or know someone who is suffering a concussion? Right, okay. We have some common ground there. So first I'm just going to cover some scientific topics. So symptoms, risk, susceptibility, diagnosis, prevention, and treatment. Again, I'm not a doctor, so please take everything I say with a grain of salt. And then there's some psychosocial challenges that I wanted to talk about, and how I think there's a huge lack of awareness about what a concussion actually is. And a little bit more personally, I'll just talk a bit about how there's a loss of identity and some mental health practices and tips that I use to improve my situation. And then I have a lot of resources just in case you'd like to know more. So I'm sure you guys all know this, but what is a concussion? It is defined as a traumatic brain injury induced by biomechanical forces. And this is due to your brain hitting the inside of your skull. So this actually causes bruising and swelling of your brain. And there's no such thing as a concussion-proof helmet. And that makes sense, right? Because when you think about how the injury occurs, your skull is your brain's helmet, and you can't provide further protection from that. So, not only is there swelling from the contusion of hitting your skull, but there's also something called diffuse axonal shearing. So this is the actual shearing of your neurons, which can cause neurodegeneration, and this is seen in more extreme cases, so it doesn't always occur, but it more commonly occurs when you have a rotational hit, and most concussions do involve some sort of rotation unless you're perfectly hit on the side of your head, which is rare. So then there's some cellular characteristics of acute TBI. Because I study neuroscience, I was really interested in this, so excuse me if this is too much detail, but in case you're interested, this is how the force of the injury actually affects your brain on a cellular level. So it actually causes a vulnerability in the cell membrane. So this causes a dysregulation of ion flux, so you get a huge influx of sodium and calcium, efflux of potassium, which causes action potentials, and this causes a release of excitatory neurotransmitters, which results in your cells having to make up for this by pumping the sodium and potassium ions back to their respective sides of the membrane to maintain homeostasis, and this requires ATP. So you go into this huge state of ATP deficiency and increased demand for glucose, which is also associated with some symptoms such as reactive oxygen species, which cause inflammation, and there's some microtubule breakdown, which is a stabilizing protein, structural protein in your cells. So you get this release of a protein called tau, which can then lead to tau fibrillary tangles, which are seen in brain slices in rats. So then there's this, overall this causes a huge state of energy dysregulation and a state of hypometabolism, so lowered glucose metabolism, and they think that this could possibly what is causing symptoms until they resolve. It's kind of scary to realize what's happening, but it's just a lot of inflammation, and we see increased number of microglia, which are your kind of helper cleanup brain neuron cells, and alpha-synuclein aggregates, and decreases in creatine and DHA, which I will talk about a bit later. So 4 to 6 million people are currently on disability due to chronic or severe conditions resulting from TBI, so it's quite alarming, and you can imagine the financial costs and social costs associated with this. And there's also a 1.5 times increased risk of developing depression after TBI, and this statistic was from 2002, so I'm sure there's updated ones now. But in general, these are the symptoms. There's a wide range, but the main ones being temporary headaches, feelings of pressure in the head, sensitivity to light or sound, problems with concentration, memory, balance, temporary loss of consciousness, and there's also, this is a big one that people commonly think is necessary to have a concussion, but it's not true. You can definitely have a concussion without losing consciousness. In fact, 90% of concussions do not see loss of consciousness. There's other symptoms such as dizziness or seeing stars, nausea, ringing in the ears, delayed response to questions, sleep problems, that's a big one for me, cognitive fatigue, anxiety, and mood disorders. And then if you see these, you need emergency action. Sorry, you want to see that. And then these are some commonly used assessment tools. So I'm sure you've heard of these, but these are the ones that are most commonly used. The SCAT-5, so there's now the 5th version has come out. It's the Sports Concussion Assessment Tool. And I know that it is 22 questions long, and they ask you questions like, how are you doing on a subjective scale of 0 to 6? And there's those other ones there that I don't know much about. So these are all great tests, and they've been validated, but they are all subjective. So in order to get a more objective sense of what a concussion truly is, we are hoping to have more objective levels or ways to measure concussion. So these two biomarkers are found in the blood, and they have both been FDA approved. So that's serum neurofilament light and tau. So these still need to be put into clinical practice by establishing a reference interval so we can determine what's normal and then use it for diagnosing patients. So this is a graph that shows the recovery trajectory that shows that you're more susceptible to prolonged concussion symptoms with repeated concussive injuries. So if you can see, there's that really light line that shows 2 or more repeated injuries, so you can see that they take longer and they have more symptoms as time goes on. So try not to get reconcussed. This movie came out recently. It's based on a book about the true story of the discovery of chronic traumatic encephalopathy, and it's a really great movie and book, audiobook even, if you want to learn more about how the history of what a concussion can do to your brain came about. So after this kind of spurred a whole bunch of research. So this research was done in a NFL player's brain, Mike Webster, and they found the same pathology that is seen in Alzheimer's patients in the postmortem brain slices. So that would be amyloid beta plaques and tau. So it's kind of scary to see these findings come out that repeated concussions can lead or possibly increase your risk of Alzheimer's disease, Parkinson's disease, and epilepsy. But we do need more research before we can fully validate these findings, as in all science. But anyway, we're gonna talk about some of the symptoms. So there's a huge range of symptoms, as you can see. This kind of categorizes them into 3 groups. So somatic, like headaches, affective, so your mood, as well as cognitive, so your ability to do cognitive tasks. And they're pretty equally distributed throughout this study's population. And then what's really interesting to me is that most people do recover within 2 to 4 weeks, but there is still 10 to 20% of people who are concussed that have symptoms that last longer than 1 month. And this is a finding from the recent report, the consensus from 2017. Which was made by an international working group of professionals in the field of concussion. So they recommend, as your symptoms are still prolongingly there, to increase the amount of health professionals and help that you seek, which makes sense. I'm sure we all have done that. So a little bit about returning to activities. This is really hard to do properly. I know I felt a lot of setbacks and challenges in trying to get back to my level of activity, because when you have a concussion or any major injury, you are at home resting, and it's hard to participate in your daily activities that you once were doing. But the new research is saying that you should rest for 24 hours, after which time, if your symptoms allow, you should slowly return to activities. So I got some conflicting advice when I was concussed. My doctor just said, go home, rest. And I didn't know what that meant. So I laid in my bed and stared at the ceiling. And I think in retrospect, that was not the best thing I could have been doing. Getting the blood moving and flowing with exercise, like very light exercise, has been shown to be very beneficial, but I'll get into that a little bit later. And the staircase here is just depicting that there will be steps up and steps back, but in the end, it's important to focus on the light of full recovery. So here's some interesting findings that I have heard through various colleagues as a neuroscience student, as well as just from doctors and friends who have had similar experiences. So don't quote me on these, but lower HDL is correlated with worse TBI symptoms. So that's just pointing out that what's good for your body is also very affecting your brain. So it's good. It's a full body symptom. Progesterone lessens severity of TBI symptoms. It's used in more like severe cases, but we're not really sure why. Studies in rats have found that repeated TBIs can result in increased impulsivity. This is research done at UBC. There's also functional connectivity changes that have been observed using fMRI. Yeah.
What's impulsivity?
Oh, good question. So impulsivity being ability to control your impulses, so being more distracted, or the test that they actually used in the study was how quickly the rat would go eat the sugar pellet. So just like delayed gratification, sort of. And the majority of people do recover. However, I just wanted to throw in this slightly scary finding from a journal in 2017 that says that if symptoms are lasting 3 years or longer, you're not likely to see full recovery. However, I'd like to point out that there are probably many other factors involved, and perhaps this population didn't take all of the steps that would be helpful for them to recover. Just trying to stay positive, but this is something that I found really interesting because I also had some whiplash injury, which most concussions are associated with, because the minimum force required to give a concussion is over the threshold for whiplash injury. So you do see a lot of similar symptoms, and there's differences in sex because of neck size and muscles. So females have smaller necks, smaller muscles, so they tend to see longer whiplash symptoms. And then this is really interesting, is that your spinal segments 1 and 2 converge into one nerve in your brain. So your brain can't perceive the difference between neck pain and head pain. So you could be having headaches that are actually due to sore or stiff back and neck muscles. And this also can influence the vagus nerve and cause increase of anxiety symptoms. So the vagus nerve and your entire nervous system is kind of in this hyper-aroused state after a concussion, which makes sense. And so it's really about finding treatments that will bring you back down and lower your anxiety levels, which I will get into later. So quickly, a note on drugs. I know this comes up a lot because it's commonly prescribed. So Advil and Motrin, they can help reduce your headaches. But then I want to talk about antidepressants and amphetamines. So some of the commonly prescribed ones that we see are amitriptyline and dextroamphetamine. So I was prescribed dextroamphetamine because it was supposedly to treat the symptoms of distractibility, which I was having. So I was trying to get back to school, and my doctor said, well, this will help you focus. And I said, wait a second, I'm not comfortable with this because I study neuroscience and I know what goes on a molecular level, and it just wasn't, for me, it wasn't as drastic of a situation to the point where I felt like I needed that extra help. However, I'm not saying all drugs are bad. They can be helpful in lifting you out of a rut if you're having sleep disorders or mood disturbances. So just a quick little, I won't go into that much detail, but this is the mechanism of antidepressants. So there's a lot of structural changes that are going on at a synaptic level, and to me, I felt that this was a little bit too drastic, and we know that these drugs do work. They do treat the symptoms, but they don't treat the underlying cause of concussion. And we still don't even know how they work to treat depression and anxiety. We just know that they do have positive effects for the most part. So I chose to go the more integrated, multi-pronged, holistic way. So I tried therapies such as exercise, physio, chiropractor, eye exercises, cool laser therapy, acupuncture, nutritional supplements, meditation, yoga, and then something that was kind of overlooked at first, but what I found to be really beneficial was just activities that make you feel good. So just having tea with a friend or going for a walk in the woods. Coloring was really big. And then also just reaching out to family and friends to feel understood and loved and supported, which helped